Okay, so we're going to do an example or a demonstration of video laryngoscopy now. For this demonstration, I am going to go ahead and use at least part of my proper PPE. So proper PPE for intubation is a set of goggles and a mask, or you can use a combination goggles and mask together. For purposes of the demonstration, I'm not going to put the mask on so that you can actually understand me. So I am going to go ahead and put my goggles on and my gloves. My partner is going to go ahead and ventilate the patient as soon as I get an oral airway in place. Okay, and you can ventilate the patient. So, probably normally I would have gotten my gloves on before this point, but we're getting good chest rise, but we are going to go ahead and intubate this patient. So I have 3 sizes of ET tubes here. I have a 7, which is what I happen to know I need for this patient, but I also have a half size below and a half size above. So if for some reason that the size I've chosen doesn't work for this patient, I can quickly grab another size. So I'm going to go ahead and open this and just make sure everything works. Grab my syringe here and put about 5 to 10 milliliters of air in the cuff, and it looks good. So I'm going to go ahead and pull that back out and leave this here ready to go. I will also lubricate the tube. Use a little bit of this lubricant that's for training mannequins. Okay, that's ready to go. And I'm going to double check my video laryngoscope. So this is all hooked together. So normally when these come, you'll find that the blade part comes separately. There are a couple different types of blades for this brand of device. So you want to make sure it all clicks together, turn it on the back, and then make sure that you can see a good picture in the screen. And then I'm also going to make sure that I have my capnography supplies handy. And then I'm also going to insert the stylet into the tube so that I have it ready to go. And I just want to double check and make sure that my stylet fits for this tube and that it doesn't extend beyond the end of the tube, and you can see that it doesn't. Okay. So when I'm all ready and I've checked all my supplies, then I will go ahead and tell my partner to stop ventilating. And I will remove the oral airway, reposition the patient's head slightly. I'm going to insert the video laryngoscope. Now I happen to know that with this device, we don't want to intubate too far, or it makes it difficult to get the tube in place. So I'm going to stay back just a little bit. There we go. Push that cuff just past the vocal cords, and then remove the video laryngoscope. Remove the stylet. Fill the tube. About 5 to 10, and then I'm going to have my partner start ventilating. And I'm going to hang on to this tube until I get a device in place. Meanwhile, I'm going to go ahead and check for breath sounds and listen over the epigastrum. Listening for air, indicating that we over the epigastrum, indicating that we may have intubated the esophagus. And I'm going to listen for breath sounds, and I would like to hear bilateral and equal breath sounds. If I hear breath sounds on one side or the other, then I might have to back my tube out just a little bit, but I do have good equal chest rise. And so I think I'm ready to go ahead and either have a colorimetric device here, or I can hook up my capnography line. So for purposes of this demonstration, we're going to switch back to the capno line. And of course, once you're intubated, the proper, once you've intubated the patient, the proper breaths should be 1 breath every 6 seconds, regardless of age. So I'm going to plug this into my monitor, and that way I can continuously monitor the placement of my endotracheal tube. So then I can go ahead and hook up my commercial device. So I've got stuff in the way here coming from the top. And then I would also note at some point here that my number for this tube is about 19 of the teeth. So that's down on the face good. Okay, so that's tight around the tube. Not going to allow the tube to go anywhere. Tuck this underneath. Pressurize that. And tighten it down. And then we would continue to breathe for the patient and continue to monitor the capnography. So.